In the world of public health, some victories feel certain, like diseases we have relegated to the history books. For many years, measles felt like one of those victories in the United States, a once common childhood illness that became rare thanks to a safe and effective vaccine. However, in 2025 we are facing a difficult and concerning reality. Measles is making a significant and unwelcome comeback. This isn't just a small uptick, it's a nationwide health alert that has put doctors, parents, and communities on high alert. The conversation has shifted from celebrating its near elimination to actively fighting its resurgence across the country, reminding us that our battle against infectious diseases requires constant vigilance. The numbers for 2025 paint a stark and alarming picture of the measles resurgence in the United States. As of August 19, 2025, public health officials have confirmed 1,375 measles cases across 42 jurisdictions. To put that figure into perspective, it represents the second highest number of cases we have seen in a single year in the last quarter century. This isn't a minor fluctuation. It is a significant public health event that demands our immediate attention and a coordinated response from every level of our healthcare system. The single largest outbreak this year began in Gaines County, Texas, in January 2025. This one outbreak alone has been responsible for a staggering 654 cases. Among the reported cases in 2025, an overwhelming 96% of patients were either unvaccinated or had an unknown vaccination status. The story of the largest measles outbreak in 2025 began in Gaines County, Texas, late in January. What started as a few isolated cases quickly escalated into a major public health crisis, confirmed at 762 total cases. Health officials reported that 99 patients required hospitalization for severe complications including dehydration, pneumonia, and dangerous brain swelling. Tragically, the outbreak also resulted in 2 deaths among unvaccinated school-aged children, heartbreaking testament to the real-world stakes of this preventable disease. To protect ourselves from measles, we must first understand how it behaves. Measles is caused by a virus that is incredibly contagious. It spreads through the air when an infected person coughs or sneezes, and can live for up to 2 hours in the airspace where the infected person was. The illness usually begins with symptoms that can easily be mistaken for a common cold: high fever, persistent cough, runny nose, and red, watery eyes. A few days later, the classic measles rash appears, starting as flat red spots on the face and spreading downward throughout the body. While most people recover, the disease can lead to serious complications including pneumonia, encephalitis, and permanent hearing loss. Without proper protection, measles can be deadly, which is why it must always be taken seriously. The story from Pennsylvania shows how one person with measles can spark a public health scare across multiple communities. A visitor from another state made stops at everyday locations: truck stops, restaurants, and family entertainment centers. The most significant exposure occurred at the Midway Mennonite Reception Center in Lititz on August 8th and 9th. Public health teams worked rapidly to identify and notify people who were at the center, creating anxiety throughout the community while demonstrating how quickly measles can travel. The most effective tool we have is the MMR vaccine. Safe, incredibly effective at 97% protection with 2 doses. Vaccination isn't just about protecting yourself, it's about protecting the entire community through herd immunity. In Lancaster County, vaccination rates have fallen below the 95% threshold needed for herd immunity, creating dangerous pockets of vulnerability. These gaps put the most vulnerable at risk: infants too young for vaccination and immunocompromised individuals who cannot safely receive vaccines. The most important step you can take is ensuring you and your children are up to date on MMR vaccinations. If you believe you've been exposed, check your vaccination records and call your doctor immediately. Don't go directly to a clinic without calling first. While the rise in measles cases is a serious challenge, it's one we know how to solve using the same tools that nearly eliminated this disease years ago. By embracing vaccination, staying informed, and supporting public health systems, we can ensure our communities remain safe places for children to grow and thrive, free from preventable diseases.